Hello and welcome. Today we're diving deep into a condition that can significantly impact a woman's quality of life: bladder endometriosis. This occurs when tissue similar to the lining of the uterus, the endometrium, grows outside the uterus, and specifically, within or on the bladder. While endometriosis is common, affecting an estimated 10% of women of reproductive age, bladder involvement is less frequent but can cause a unique set of challenges. We'll explore the causes, symptoms, diagnosis, and treatment options available for this condition. The exact cause of endometriosis, including bladder endometriosis, remains a topic of ongoing research. However, several theories attempt to explain its development. One prominent theory is retrograde menstruation, where menstrual blood containing endometrial cells flows backward through the fallopian tubes and into the pelvic cavity, potentially implanting on the bladder. Another theory involves the transformation of cells outside the uterus into endometrial-like cells. This could be triggered by hormonal or immune factors. Genetic predisposition may also play a role, making some women more susceptible to developing endometriosis. Finally, surgical procedures, such as cesarean sections, may inadvertently lead to the implantation of endometrial cells in other areas. Let's understand how bladder endometriosis affects the body. Endometrial tissue, wherever it's located, responds to hormonal fluctuations, especially during the menstrual cycle. This means that the endometrial implants on the bladder will grow, bleed, and cause inflammation, just like the tissue inside the uterus. This cyclical bleeding and inflammation can irritate the bladder wall, leading to pain, scarring, and potentially affecting the bladder's ability to store and empty urine effectively. Over time, this can cause a range of urinary symptoms impacting daily life. Bladder endometriosis is a relatively rare form of endometriosis. While endometriosis itself is estimated to affect around 10% of women of reproductive age, the percentage of these women who develop bladder involvement is much lower. Studies suggest that bladder endometriosis accounts for only about 1% of all endometriosis cases. However, the true prevalence might be underestimated, as the condition can be difficult to diagnose and may be misdiagnosed as other bladder conditions, such as interstitial cystitis or urinary tract infections. The symptoms of bladder endometriosis can vary in severity and type from woman to woman. Common symptoms include cyclical urinary frequency and urgency, meaning the need to urinate more often and with a sense of urgency, especially during menstruation. Hematuria, or blood in the urine, is another possible symptom, also often coinciding with the menstrual cycle. Painful urination, known as dysuria, and suprapubic pain, which is pain in the lower abdomen above the pubic bone, are also frequently reported. In some cases, women may experience symptoms similar to a urinary tract infection, even when no infection is present. The cyclical nature of these symptoms, worsening around menstruation, is a key indicator. Diagnosing bladder endometriosis can be challenging due to its overlap with other bladder conditions. A thorough medical history and physical exam are the first steps. Urine tests and cystoscopy, where a small camera is inserted into the bladder to visualize its lining, may be performed. However, these tests may not always be conclusive. Imaging techniques, such as MRI or ultrasound, can help to visualize endometrial implants on or within the bladder wall. Laparoscopy, a minimally invasive surgical procedure, is often considered the gold standard for diagnosis. During laparoscopy, a surgeon can directly visualize the bladder and surrounding tissues, confirm the presence of endometrial implants, and even take a biopsy for further examination. Bladder endometriosis is not typically classified into distinct types like some other diseases. However, it's often described based on the depth of invasion into the bladder wall. Superficial endometriosis involves implants on the outer surface of the bladder, while deep infiltrating endometriosis penetrates deeper into the bladder muscle layers. The depth of invasion can influence the symptoms and treatment options. Treatment for bladder endometriosis aims to alleviate symptoms, reduce the size of endometrial implants, and improve the woman's quality of life. Treatment options can be broadly categorized into medical and surgical approaches. Medical management often involves hormonal therapies, such as oral contraceptives, progestins, or GnRH agonists, which suppress the growth of endometrial tissue. These medications can help to reduce pain and other symptoms, but they don't eliminate the endometriosis. Surgical management, typically performed laparoscopically, involves excising or removing the endometrial implants from the bladder. In some cases, a partial cystectomy, where a portion of the bladder is removed, may be necessary if the endometriosis is deeply infiltrating. Pain management strategies, such as over-the-counter pain relievers or prescription medications, can also be used to help manage symptoms. A multidisciplinary approach involving gynecologists, urologists, and pain management specialists is often recommended. Currently, there are no definitive ways to prevent endometriosis, including bladder endometriosis. However, some lifestyle modifications and hormonal strategies may potentially reduce the risk. Maintaining a healthy weight, engaging in regular exercise, and avoiding excessive alcohol and caffeine consumption may be beneficial. Early diagnosis and treatment of endometriosis in other areas of the pelvis may also help to prevent its spread to the bladder. Hormonal contraception, particularly continuous regimens, may reduce the frequency of menstruation and potentially lower the risk of developing or worsening endometriosis. The prognosis for women with bladder endometriosis is generally good with appropriate treatment. Surgical removal of endometrial implants can often provide significant symptom relief and improve quality of life. However, recurrence is possible, particularly if all the endometriosis is not completely removed or if hormonal factors continue to stimulate its growth. Recent research focuses on developing more targeted therapies for endometriosis, including medications that specifically inhibit the growth of endometrial cells and reduce inflammation. Advances in minimally invasive surgical techniques are also improving outcomes and reducing recovery times. Ongoing research into the underlying causes of endometriosis may eventually lead to more effective prevention strategies and potentially even a cure. If you suspect you have bladder endometriosis, it's crucial to consult with a healthcare professional for proper diagnosis and personalized treatment.